First of all, I'd like to define what is an incontinence. The urinary incontinence is considered any accidental or involuntary loss of urine from the bladder. However, there are different types of incontinence, and each type has quite different causes. So, generally speaking, there are two major types of incontinence. The stress urinary incontinence due to the weakness in muscles blocking the exit from the bladder, otherwise called the bladder neck. And the second type is urgency urinary incontinence, which is caused by an increased bladder tone, which increases the pressure of urine so much that it can pass through a strongly closed bladder neck. The stress incontinence usually occurs with a cough, sneeze, physical effort, movement, sports, jumping on trampoline. The urgency incontinence happens when urine leaks with a sudden feel of intense urge to pee. In other words, when you feel you need to go to the toilet and don't make it on time. So discussing about the first type, which is the stress incontinence, and the urgency incontinence actually as well. The age is the main risk factor. Usually it occurs in the second half of life, and the incidence is increasing by the age of 18. Childbirth is another significant risk factor, specifically for stress incontinence, especially the vaginal birth. However, cesarean section does not offer 100% protection. It happens after a cesarean section as well. Also, any factors leading to increased pressure in the abdomen, like persistent constipation or cough, heavy lifting, obesity, pregnancy, leads to stress urinary incontinence. There are some connective tissue disorders like Ehlers-Danlos syndrome and others, which are producing bad quality collagen, which does not allow the bladder to close tightly and keep the urine. Also, there are sometimes postoperative complications. It may happen after hysterectomy, after prolapse surgery, other pelvic surgery. Regarding the urgency incontinence, which is the second type, so the most likely cause affecting your bladder is lifestyle, is smoking, drinking too much fluid, too much alcohol and caffeinated drink intake. When I'm saying caffeinated drinks, this includes tea, coffee, hot chocolate, everything which contains caffeine, not speaking about Red Bull or other fizzy drinks. All these are irritating the bladder and inducing overactivity. Also, which is interesting, not drinking enough may cause overactive bladder as well, because the urine becomes concentrated and can irritate the bladder. Urinary tract infections, especially the recurrent ones, are leading to constant irritation of the bladder, causing the same symptoms. Constipation, which is associated with the pelvic floor muscle spasm, may lead to this. There are some neurological diseases like Parkinson's disease or multiple sclerosis which are affecting. So there are many factors, and they are different for different types of incontinence. This is a very interesting question. It's probably worth mentioning that probably at least 1 in 3 women after giving birth are having some sort of incontinence. However, it is probably interesting to know that this is a temporary change occurring in the body during and after the childbearing. They are induced by hormonal change and breastfeeding, and the tissue becomes watery and stretchy. It takes about 3 to 6 months before it comes back to normal after delivery, and usually by this time all the symptoms will improve in majority of patients on their own without doing anything. This is a very reassuring fact. However, there are some additional steps the patient can do to help their body to recover quickly, like lifestyle change, physiotherapy. Also, if the symptoms are not improving or persist after 3 to 6 months, probably is worth discussing with your doctor. You may benefit from a referral to a physiotherapist or have some medicamentoous treatment initiated by your GP. Well, the breastfeeding is not causing urinary incontinence on its own. However, it's delaying a bit the return of hormonal form to pre-pregnancy one. And as a result, it may take longer time for the symptoms to improve spontaneously without doing anything. The lifestyle factors are like drinking a normal amount of fluid. It should be at least 1.5 liters of fluid a day, which is probably 6 to 8 glasses. A high fiber diet to avoid constipation. Also avoiding drinking caffeinated drinks. Stop smoking because the nicotine is irritating the bladder. The same does the spicy food. Cutting down on spicy food may help with the overactive bladder. Avoiding lifting and constipation may help. Pelvic floor exercises are very important, and doing regular pelvic floor exercises helps significantly, especially if they are supervised. There is another technique for overactive bladder, for urgency incontinence, called bladder training. The bladder training is a special technique to increase the bladder capacity. Every time you're going to the toilet a bit later, 5 minutes later, and the bladder is stretching and allowing you to decrease your number of episodes you're going to the toilet and decreasing your urgency incontinence episodes. Also, for those with stress incontinence, probably it's worth considering using a large vaginal tampon, because it's working by compressing the water pipe, the urethra, and it may prevent from incontinence when going on a trampoline or some physical activities. Also, there are some devices, medical devices compressing the urethra, being inserted in the vagina. They are available on Amazon, eBay, and other websites. There are no tablets specifically licensed for long-term use in stress incontinence. Some antidepressants may use it as short-term, but they're not really effective. The mainstay treatment here would be pelvic floor exercises, followed by compressing devices, tampons, or vaginal pessaries, which are occluding the urethra from the vagina. The other option would be operative treatment. There are medications used for the urgency incontinence. They are relaxing the bladder muscle, and accordingly they are increasing the capacity, decreasing the urinary frequency and urgency. However, you need a medical review to see all the contraindications, other medications you are taking before being prescribed with these medications. Yes, as mentioned above, the pelvic floor exercises, bladder training, lifestyle change, vaginal tampons, and pessaries occluding the urethra. It depends on the patient's preferences and lifestyle, but again, the latest one that should be discussed with the doctor probably. There are different surgical treatments. It may last from 30 minutes for a urethral injection of a gel and done as a day case procedure, to a 3-4 hours open or keyhole surgery. However, this is to be decided individually. Not every operation is suitable for each patient. The recovery after the small procedure is about 1 to 2 days. After the major surgery is about 6 weeks. And usually the longer operations are more effective on long term. However, on balance, they are exposing the patient at more significant risks of complications.